A call has been made for government to institute a lockdown of the country in a bid to contain the spread of the coronavirus. That call comes from Dr. Terence Drew, the St. Kitts Nevis Labour Party chairman and opposition spokesman on health. In an interview with SK Newsline, Dr. Drew said a lockdown, even a partial one, will be beneficial to maintaining the health of the nation. Dr. Drew also said it's time for the government and opposition to work together as this is a national health crisis.
It is very important because we want to form a oneness that you can project to the country, and that helps to build confidence. But apart from that, different legislations, possible legislations could be discussed. Would we need to go to Parliament to pass anything? And you can also discuss ideas of how to deal with this virus, how to prevent it first from coming to our country, and if it gets here, what would be done in order to stop its spread and protect our people. However, the government up to this point has not reached out to the opposition. The opposition and the leader of the opposition, Dr. Denzil Douglas, at least in that time, and the leader of the he's still the leader of the St. Kitts Nevis Labour Party, he has been asking for this meeting or coming together. I have been asking for that for a number of weeks now.
Meanwhile, Dr. Drew said there are some areas in which government can improve, but feels the authorities waited too late to implement certain measures.
I ask that they prepare a separate space in JNF so that you don't have mixing of the patient population, those who might be treated for the COVID-19 and those who are treated for other things, so that there's not a mix of the patient population, because you can have contamination. That has not been done. What I've been told is that they cleared out the private ward to put these patients there. I think a separate area in the old hospital could have been retrofitted to have those patients, especially there, and protect as much as possible the rest of the population, because we have a very small hospital. I also spoke about getting ventilators, the breathing machine, the lung machine. Up to today, I cannot get information that these machines, that they have reached. And now we are seeing that countries are running short. And America now is saying that they will not be selling any. So I know that there's a company that would have donated to the government, but are these ventilators available so that we would be able to buy them? But as far as I know, they have not reached it. So we are behind with that. And as a result of waiting too late to really monitor our borders, even if we did not close the borders completely, everybody who came through needed to be tested, interviewed, and many persons passed through the borders without having this interview, without having this, without being examined.
Up to News Time Friday, only 2 confirmed cases of the coronavirus reported by the Chief Medical Officer, Dr. Hazel Laws. Andre Huey, SKN Newsline.